This is Katie Heller, and I'll be discussing the effect of contraction type on muscle recruitment, specifically differences observed in eccentric loading. Surface EMG is a great tool for looking at muscle activity as it correlates to motor unit recruitment. Several factors contaminate EMG data, however, so it is important to normalize these data to a percent maximal or a reference voluntary contraction. The literature on contraction type differences has found that lengthening or eccentric contractions have shown less recruitment at a given muscle force compared to concentric or shortening contractions. This difference may be attributable to lower rates of discharge among motor units for eccentric contractions. The purpose of this study was to identify what muscle recruitment differences between isometric, concentric, and eccentric contractions could be identified when examining surface EMG amplitude. I hypothesized that lower levels of recruitment would be observed in eccentric contractions compared to isometric and concentric contractions. 8 students from Regis University's class of 2019 Doctor of Physical Therapy program were recruited for the study. Any students with upper extremity injury or latex allergy were excluded from this study. Figure 1 shows proper subject setup after skin preparation and placement of electrodes on the flexor and extensor muscles of the wrist. A reference electrode was placed at the biceps brachii muscle. Maximum voluntary contractions were then performed for each type of contraction studied, which were later used for normalization of data to percent maximal voluntary contraction. Isometric, concentric, and eccentric contractions were performed at the flexor and extensor muscles through the entire range of motion using 5-pound weights for 5 seconds each. Table 1 displays the average percent MVC and standard deviation for each contraction condition. As you can see in Figure 2, muscle recruitment, measured by average percent MVC on the y-axis, varied both by contraction type as well as muscle group on the x-axis. Average percent MVC was greatest in the concentric wrist flexion condition and was followed by isometric, then eccentric contractions. For wrist extension, concentric contractions produced the greatest percent MVC again, followed by eccentric and isometric contractions. Extensor average percent MVC was consistently greater than that of the flexor muscles. However, this relationship was not an interest of the current study. If percent MVC is a valid measurement of recruitment, we can conclude that eccentric contraction experiences less recruitment of motor units than concentric contraction. The literature suggests this may be a result of neural inhibition affecting motor unit discharge rate at the spinal level. Future research comparing temporal differences in muscle recruitment of different contraction types will be beneficial to better understand these differences. PTs should consider these results in designing rehab programs for patients with neuromuscular implications. Programs that maximize eccentric rather than concentric contractions may most efficiently develop strength in those with limited neural resources. Please notice my references on the bottom right-hand corner of the presentation, and thank you for listening.